Circolone. I am so excited to be here as always. A couple of weeks ago, we talked about medial and lateral epicondylitis. I gave you some stretches to do with them. Well, today, I'm going to give you some strengthening exercises using a band. There's going to be several exercises. Now, one thing I preface the most on this is whatever arm you're having pain with, make sure you do the same exercises on the opposite arm. We want to keep things even. I'm a firm believer that no matter what injury you have, if you have an injury to an extremity, you want to work the other extremity as well. It's always important that we try to keep that balance. This exercise we're going to do a flexion of the wrist. We're not doing a curl. That's going to come in a minute, but we're going to actually flex our wrist up. So if I turn it a little sideways, you can see me flexing my wrist up like this. The other exercise, you're going to extend it up like this. You're going to bring it up towards you just like this. These two exercises are going to strengthen both the medial and the lateral muscles to help decrease some of the pain and increase the strength in the epicondyle area. The exercise I want to do next, a bicep curl. Why are we doing a bicep curl? Because the distal aspect of the bicep is implicated in epicondylitis. So we're not going to be doing a full curl with this. What we're going to be doing is we're going to be keeping it 90 degrees and holding that position for 5 to 10 seconds. We want to hold that and we want to feel that distal bicep engage and stay strong and tight. The exercise I want to do next, internal rotation, external rotation. When we do internal rotation, our wrist is going to be up and we turn it inward into the body. And we turn it and we hold it 5 to 10 seconds. Again, we're going to do 3 sets of 10. The opposite side, we hold it with the palm down and we rotate outward. That's external rotation. So let's recap. The first couple exercises we do, remember, we have the extensions where we're extending out the wrist. Sometimes I allow my fingers to go out and that'll help a little bit. Then we're doing a flexion of the wrist. We do an extension and we do a flexion, holding everything at 90 degrees. The next exercise, we turn it around and we extend up and then down. You will really feel these in your forearm when you're doing it and will help strengthen up that area so we avoid injuries to it. When we do internal rotation, our wrist is going to be up and we turn it inward into the body. And we turn it and we hold it 5 to 10 seconds. Again, we're going to do 3 sets of 10. The opposite side, we hold it with the palm down and we rotate outward. That's external rotation. So when we're holding it up, internal rotation. When it's down, it's external rotation. All of these exercises, again, we were going to do for 5 to 10 seconds. We're going to do 10 of them, and we're going to do 3 sets. Guys, I hope these help you.